I'm Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia, and welcome to Psychotherapy and Applied Psychology, where we explore practical insights with leading experts. Today, I'm thrilled to welcome back Dr. Carl Castro, a world authority on military and veteran mental health. In our conversation, we discuss the combat veteran paradox, the PTSD paradox, stigma, innovative approaches to PTSD treatment, veteran suicide, and much more. And please feel free to leave a comment below. And if you enjoy this conversation, it would be appreciated if you hit the like button and subscribe to the channel. This episode begins with Dr. Castro responding to my question about what he thinks the countries are doing to facilitate military to civilian transition that he thinks that America could learn from. Let's jump in.
I will tell you this, and I sometimes get in trouble internationally because I say this in other nations. There is no country in the world, none, zero, that comes close to supporting veterans like they do in America. None, zero. Now, does that mean that America does it perfect? No. But if you're going to start comparing, what are the Joneses doing? What are the Smiths doing? Veterans are really, really taken care of in America compared to other countries by a mile. Other countries are envious of how well not only our nation takes care of veterans, but how veterans are embraced and looked upon. It's just really different. I would say probably the closest country to the U.S. is Canada. Really, really positive as well. And getting better, by the way. They're actually making substantive changes to help veterans. But most countries are, and this comes, by the way, in how veterans are defined. We can talk about that, but most countries define a veteran as someone who served in combat. If you haven't served in combat, you're not a veteran. Canada doesn't have that definition. America doesn't have that definition. The United Kingdom doesn't have that definition, but almost every other country, if you haven't been on an operational deployment or served in combat, you are not technically a veteran and you get no veteran benefits. So it all comes down to definitions ultimately, right? I mean, that's what I always tell my students. I said, always pay attention to how things are defined because that determines who gets benefits and who doesn't. More importantly, it's the opposite who's included, who's excluded. So things like who's a veteran, who's homeless, how is that defined? Oh, you're not homeless because you're living with your parents. But if you're living with your girlfriend or your boyfriend, then you would be considered homeless. Bizarre definitions, admittedly, but that's just how they're defined. You don't have to be on the street to be homeless. You could just not have a home. Couch searching, living in your car, staying in a motel. You're you would be considered homeless, although you're not on the street. So
One of the things
definitions are important.
I'm always fascinated by by the like Israeli military service since it's compulsory, and like talking to folks about like veteran, like they don't really use the word veteran from what I understand
No,
because
they don't.
everybody served. So yeah, I don't know, I was just thinking about that when you're talking about definitions
Well,
and
you
those
make
sorts
a
of things.
good point. Like I have a lot of friends, a lot of colleagues who I've heard a lot of generals say this, a lot of admirals say this that military service should be compulsory. Okay, and it was yeah because it really has a positive influence on overall even those who had a very unpleasant time in the military. When they reflect back, will say, "Yeah, it was one of the best times of my life." But here's the flip side of it, and you alluded to it. If everybody served in the military and everyone was a veteran, then veterans wouldn't be special. They wouldn't get these unique deals because we would all be in the same boat. And you be like Israel. They don't even talk about veterans because everyone's a veteran. And they wouldn't care about your war because we've all had our own wars, right? And well, when I was in, everyone always suffered more than the next person. But by having only this elite group of about 6 to 8% who've served as adults, who've served in the military, that makes us unique. It makes us different. Versus if we're all the same, then nobody's different, right? And And people who advocate for this aren't really thinking through the long-term implications. Now, it might be that we say, well, despite that, we think everybody should serve. Well, okay, fine, but just keep in mind that a lot of these benefits and programs that are put in place to help veterans probably will go away because we'll all be in the same boat. So you won't be disadvantaged over anyone else. So you shouldn't get anything special. So those are I always think about these kinds of issues that we're in a very unique, and the number is going to get smaller and smaller as the World War II and Korean and Vietnam veterans are dying, and they are really dying in the tens of thousands a month. We're not going to have, it's just going to be veterans from, an army of 425,000 or a military of 1.1 million, not the 3 or 4 million that we had. So the number is going to go down into the probably settle in around 2 or 3% of the population, I imagine, somewhere in there of those who've served. And that makes you unique because not everybody's even eligible to serve. I mean, that's
Do
also
you
a thing that we don't talk about very much.
do you think that one of the reasons that the U.S. is particularly mindful of veterans is in response to how civilians treated veterans coming home from Vietnam?
Oh God, yes. The guilt, the guilt. I mean, this is the 60ish generation, right? They treated veterans from Vietnam poorly. Then they forgave themselves, right? So it's a generation that I've not quite got my head around, but I've never seen a generation who forgave themselves like those who were in their 20s and 30s during the Vietnam War, because they forgave themselves for every bad thing they did, from the drugs to the promiscuity to how they treated veterans. They just globally forgave themselves. And I said, well, is that how you're supposed to do that? Aren't you supposed to like ask for forgiveness? I mean, in therapy, we talk about forgiving yourself to heal, those kinds of things. But yeah, we treated you badly, but I'm forgiving myself for how badly I treated you. That's just a bizarre take in my mind. As a veteran and as someone served in the military, I think that's a bizarre take that you forgive yourself for how you treated other people. But I think the
Yeah.
guilt then is the benefits that the veterans today are enjoying because of that guilt. They're well. Let's give them the GI Bill we have today is much better than the GI Bill that the Vietnam veterans had. It's not as good as the GI Bill that the World War II veterans had, though. So you know it's a compromise, but in some ways it's better, but in general I would say it's not as good. The thing about the current GI Bill, not only does it of course pay you know tuition and school fees, but you can also give it to your children. So it's called the Forever GI Bill, so you could give it to your children or your spouse, and they can enjoy the benefits if you don't want to use them as a veteran. So there's that aspect of it is really popular. But the monetary amount was at the highest, the best during World War II veterans.
Hmm. Could you talk about the combat veteran paradox?
So the combat veteran paradox is it simply stated is that anyone who has served in combat has changed, and talking about how they changed can be beneficial. But oftentimes, the veterans themselves, the combat veteran themselves, don't know how they changed. They think they're the same person. And it's usually other people around them will say, hey, you're different. You are not the same person before you left, the one that came back. And they're usually, baffled by that because they saw the change happening slowly. Sometimes the change happens much quicker, depending on the amount of combat and trauma they experience. It could happen really sudden, but they think they're handling it and processing it very well. Yes, I engaged in firefights and I killed some people, but I'm handling it very well. And they're not. They think they are, but they're not. What they see is they're not handling it worse than their peer, their battle buddy. who probably isn't handling it well either. So you're kind of your reference point is off, right? If your reference point is someone also who's struggling, you're going to say, well, I'm not struggling as much as that person, therefore I must be doing fine. And this is usually when it takes a third party. It's usually your supervisor, your spouse, the wife saying, if you don't get some help, I'm leaving you, or if you don't straighten up, I'm firing you. And that's usually the forcing function that gets a veteran into to serious help. But I think what we could do a much better job of soldiers, Marines, airmen coming out of combat is to begin normalizing how they're going to be feeling and thinking and behaving. Because then you don't think, as a combat veteran, that you're losing your mind, that you're the only one who feels this way, because you don't know how to talk about how you're feeling, what you're thinking, even sometimes what you're doing. And of course, this gets layered on to the military culture, which is one of drinking, it's one of not admitting you have physical or mental health issues. We spend a lot of time talking about mental health issues and the stigma associated with that while we're serving. But there's a huge stigma associated with physical health issues as well, where veterans won't go in if they got a, or, service members won't go in if they got a hurt knee or a bad back, especially at the officer level, because I'm not going to get picked to be the operations guy if the general thinks that I'm physically hurt. They're going to give it to somebody else. And so you start self-medicating, or you would go out on the civilian, get a civilian doctor to help, and you just pay out of pocket because you didn't want that to be in your permanent record. So, dealing with those kinds of issues are really, really important, especially coming back from combat, where we know the physical health issues and the mental health issues are really, really prominent.
In that you wrote this paper and you articulated a bunch of different paradoxes that veterans experience, and it's a lovely paper. And I just sort of this notion for the combat veteran paradox of, you know, that like that responses to combat are normal, but because they're substantial, oftentimes folks could benefit from counseling or therapy.
Yeah,
And I think it's I think for the therapists who are listening and people who are being trained to be therapists, I think it's really helpful to keep it, particularly those who are less familiar with service, that, what you're saying, or at least what I read you saying, is there's nothing abnormal that's happening here. There's just a process. And because the process is substantial, and because it's not necessarily intuitive or obvious, it makes completely reasonable sense that service members, many of them, will benefit to have someone who can sort of be there as a sounding board to talk about things, help process things as they go through that transition, because this is a big change. And even though everything is a normal reaction, it's still notable, and maybe having a little bit of help would be helpful.
yeah, and it really is what the peer support is all based on, right? Peer support, other veterans helping other veterans, having a mentor in any profession, having a sponsor in any organization. It's the same thing. They're trying to help you navigate these various challenges. And it's just because people recognize, well, I'm joining this work. Onboarding, with the sponsor is about helping people understand processes, but also to help them handle their anxiety and fears of starting a new job. I mean, that's not usually in the onboarding manual, but that's what's happening, because you're normalizing their feelings. So you're probably worried about this. I worried about that too. Don't worry about that. And those kinds of things. All of that is just a normal process. But when you have to give a diagnosis to help somebody, then it becomes problematic, because not everything deserves a diagnosis. And some things do, don't get me wrong. Some things can be very, very debilitating. Most of these symptoms that you see around combat that we argue are very normal reactions to a very highly stressful, traumatic environment are not impaired. You're not impaired by them, right? You can still function. We know you can still function. I mean, most people with a mental health disorder, even those with schizophrenia or bipolar, can function. But but if you stigmatize it and make it sound like they can't do anything, then guess what? They won't do anything. Some of them won't do anything. And they'll take on that persona of someone who is suffering from post traumatic stress disorder or some other kind of disorder. That then becomes their life, right? It becomes who they are. And that's what you don't want to have happen. You want everything to happen to say, this will pass. You're going to recover from this. You're going to move beyond this. You're going to get over this, but what you're feeling now is quite normal. And that's the whole normalizing and contextualizing. What you did in a combat environment was necessary for you to survive. You don't need to do that now that you're back in peacetime society, because if you behave that way, that will cause some relationship issues and you could get into some legal issues. If you're still taking risk and with drinking and drugs and gambling and how you drive, and if you're aggressive, because we know combat, one of the things that, and this is across every culture, when combat veterans return home, they're more angry, they're more violent. You see that in every country I've looked at, you see this slightly more disproportionate number of folks who get a little more aggressive over little things, right? And that's another paradox. Veterans will tell you, I understand what's important in life. I know how to appreciate the important things, but they let the little things get them angry. This is which I find humorous. I said, well, you understand what the big important things are: relationships, family, your relationship with God or a higher meaning. But then you're going to let someone who cut you off on the interstate be the thing that defines who you are when you ram into them and get in trouble for that. So that's the learning to let the little things go. So it's one thing appreciating the big things, but it's another thing letting the little things go. And, just let it go. It does not matter in the big scheme of things. You know that. Every combat veteran knows that a guy cutting them off doesn't really matter. Doesn't matter at all. Doesn't mean you're not going to get angry, but that's kind of learning to let the little things go. And that's really hard to do. It's really hard to let the little things go, especially when you're in this culture of when you see something screwed up, you speak up, right? When somebody,
Like people coming late to meetings, for
yeah. So
example.
I had to let that go, right? I had to let that go. It took me a while, but I now let it go. I don't make a comment about it. Sometimes it doesn't even bother me. Sometimes it still does bother me, but but this is part of the transition. And I also tell folks that you will always be transitioning. You think I'm transitioned. I've been out of the military now for 11 years. And there are still little things that I say, damn, I did that in the military. Why am I still doing that? My wife, so I have this annoying habit of, when I lace up my shoes, I unlace my shoe, take my shoes off, and then I lace it back up because that's what I learned in basic training. You display your shoes and your clothes like you're wearing them. So I button my jackets up, my shirts are all buttoned. That's crazy that I'm still doing that, right? That's crazy that I'm still.
It looks
When
nicer. I
I
mean, it does
notice
look
and you'll see
nicer.
my shoes and you'll say, oh, he takes his shoes off without untying them. No. And that's what I hope people think because that's less bad. No, I actually untie them and then I take them off, then I retie them and then put them to the side. So it's one of those like, what would you rather be thought of as somebody who's so obsessive compulsive that they lace their shoes they're not wearing or tie their shoes they're not wearing or takes their shoes off without untying them. See, that would be bad in the military too, to take your shoes off without properly untying them. So, and I still can't wear a jacket comfortably if it's not all buttoned up.
Hmm.
And people will come up to me and they'll say, you're not supposed to button that last button on your
Right.
jacket. You know how you're supposed to leave that last
Right.
button done. And I said, yeah, I know. I don't say anything else. I just, but The funny thing is, I looked up why do we leave that last button undone? And most people don't know the reason why. The reason why this custom of leaving the last button of a jacket undone was because King George III was so fat, the King of England was so fat he couldn't get all of his buttons buttoned up, so he had to leave the last one undone. And everybody else wanted to curry favor with the king, so they started leaving their button undone, and then it became a fashion. A
Wow.
hundred, 200 years later, we're still doing it. So I don't feel too bad when I button all my jacket up because I know the history behind the buttoning and I know why I do it and I know why I know why you're leaving the last one undone. You probably don't even know why you're doing it, but I do. But it is fashion and it. But anyway, I still struggle with that. I have to have my whole jacket open. Or I got to button them all up. So anyway, it's and that's silly.
Before
I
we
should
leave,
be able to leave that last button undone, but I struggle
before
with that.
I think it's worth mentioning the PTSD paradox because I think that this sort of your paradoxes and sort of and you have about a dozen of them that you list out, but that I think this is getting to the larger issue for the practitioner who's working with a service member or a veteran who's like helping them figure out, okay, when is something a problem that needs an intervention to be addressed, and when is just something normal, adaptive, and we can sort of like help more of the adjustment process
Yeah.
versus attending to the trying to make the problem go away. So I'm wondering if you could just speak for a minute about the PTSD
Well,
paradox.
one of the things that when you look at the symptoms of PTSD, they all look pretty bad, right? Because they're explained in bad language, right? In the negative language, like your daughter is very aggressive, and I told the school I think she's just being assertive. So is it aggressive or assertive? Being assertive, is that a bad thing? No. Being aggressive, yeah, yeah, okay. So it's just the words you use to describe exactly the same behavior. Like we call, being startled, the startle response. What do we call that? Hyper alert, right?
Mm-hmm. Yeah, yeah.
But another word is hypervigilant, which is
Mm-hmm.
very adaptive in a combat environment where someone's trying to kill you. You want to be hyper alert or hypervigilant. And so in one context, it makes perfect sense. In another context, you look strange, right? And so you always have to ask yourself, what is the impairment part of it? What are you now not able to do? What are you conveying to others that's maybe embarrassing to you or disturbing for them? And I think that's the important thing that we often miss with all mental health symptoms, not just post traumatic stress disorder. I would argue with all of our symptoms and reactions that we have. And it's not that we shouldn't try, but you always keep in mind when you do a diagnosis, you have a whole bunch of symptoms and you have to meet certain criteria. But one of the criteria for all of them is at the very bottom that says it causes an impairment, right? In your social, some relationship, occupational functioning. So and that's where we don't really focus enough attention on, I would argue, is like, what is the nature of the impairment? What is it that you cannot do or you cannot do as well because of these symptoms? And if you can't really articulate that and make that linkage, then I would like that's minor. We cannot we focus on something else. Not that we can't circle back to it, but how is that impairing your abilities? And the one I think is the biggest one, just in life and with all of the diagnoses, is relationships. I'm a big believer that our relationships are the most important. And of course, it probably doesn't surprise anyone who's read anything. I see relationship as multi-level. So first, your relationship with you. How do you feel about you? How you are, what you've accomplished, right? The proverbial, can you look yourself in the mirror? So your relationship with you, your relationship with your partner, your spouse, your wife, your husband, relationship with your family, relationship with your boss at work, which we don't talk enough about. Having a good relationship with your boss at work is absolutely critical in every occupation, whether it's the dean, your department chair, your platoon leader, your manager of the whatever. Your relationship with your boss is critical, your relationship with your coworkers, and then your relationship with your community. I would even also argue your relationship with your higher being, their spiritual aspects, your religious aspect is also important. Those are all relationships. And we can get relationships right. All of those relationships were good. We'd all be happy, content. We wouldn't have any real complaints. We could, maybe not get the drive the car we want, have the latest fashion designer clothes we want, but we'd be happy because what makes us really happy as people, as human beings, are our relationships. But it begins with ourselves. How are you with comfortable with you? Now, you may be, I'm very comfortable with myself, but everybody around me doesn't like me. Okay, that could be a problem, right? You are comfortable, but what are you doing to impact your relationship with other people? Usually you're doing something, right?
Hmm.
And sometimes you don't care. That's called the old curmudgeons, who just go through life not caring, oblivious to others, and then others, oh, I didn't mean to do that, right? So you're sensitive and you're trying to change. So, but relationships are really, really important in everything we do. So I would focus on that. I always begin there, in all of my assessments and when I work with clients. I want to know how are their relationships because that will tell me more on how their symptoms are impacting their well-being if I understand that relationship. So
Yeah, this reminds me. I just had a conversation with Uli Kramer, and we were talking about who does a lot of personality disorder stuff in Europe. And so with the new ICD, that they changed it where personality just like the primary criteria is impairment. So it's that's the move is, and he said it's been a year or two that it's been since it's been deployed, and he said that everybody was sort of like I don't know how it's going to go, and he said it's been great because you're primarily focusing on that impairment, not categorizing the disorder, but the impairment, and that's what you're saying
that's
is what's
this
popping in
is
my head.
not a novel concept. I mean, people have appreciated that you could have, and I jokingly say this. I said, how many of us have worked with people, had bosses who we thought had a mental health disorder? And I think it's every one of. I mean, every hand goes up in the room when I ask that. I said, so you can actually be high functioning with a lot of symptoms, and you may say, well, they're impaired here or they're impaired there, because life is multidimensional, as I just mentioned. And you want people fundamentally to be happy with who they are. One of my things that people, once somebody asked me, what do you lose sleep over at night around veteran issues? And they thought I was going to say something like the number of cuts in this budget or cutting that. The thing I worry about the most is these folks who've served our country, and here I'm talking sort of more the elderly, who've gone their whole life suffering, and they go out suffering when we could have helped them. This needless suffering. What drove me to, you know, becoming, the research I do, it's all focused on saving lives and preventing unnecessary suffering. Because there's a lot of suffering that we're never going to be able to control, but we should try to control the unnecessary suffering. And I don't like to see anybody suffer unnecessarily, and I certainly don't like to see people dying unnecessarily. And so those are the things I really focus on. And I said, and if you think about it, in a lot of the grants that we write, they always talk about how much suffering this problem is that I'm going to address, right? So whether or not we recognize that as being the most important, it is what drives funding. It drives programs. We need a program for this. Why? Because somebody's suffering. How many are suffering? What is the nature of the suffering? It's why suicides are so important in preventing because people die from those. So if people are dying from it, then it gets our attention. If people aren't dying from it, well, then there better be a lot of severe suffering if you want me to put resources on it. So whether or not we acknowledge it explicitly, I just said, let's be explicit about what we're trying to do here. We are trying to save lives and prevent unnecessary suffering. And I think those are pretty noble professions. And whether you're a social worker or a psychologist or a psychiatrist or a nurse or a doc, any of those, I mean, all of these helping professions, what are they helping? They're helping save lives and prevent unnecessary suffering. And It's not complicated. Now, how we go about doing those things can get really complicated, but our overall approach, and you can see the military in me, what's our mission? Save lives, prevent unnecessary suffering. You do that and you're going to be successful no matter what you do. People are going to say you've lived a great life if you even reduce suffering just a tiny bit. And what I don't want to ever see is a veteran go out having suffered needlessly. That is just, I don't even like it, even if it's needless suffering. I just don't like to see people suffering full stop. But sometimes there's just nothing we can do. But those where we can help, we need to help.
What are your thoughts about PTSD treatment while folks are deployed in a combat zone?
You know, this is an issue that Alan Peterson really led the charge on during our latest wars in Iraq and Afghanistan. And there's this whole belief that you can't treat um, for post traumatic stress disorder unless you're in a safe environment. And and if you're in a combat zone, then you can't do that. But then other people point out, well, we have prisoners who are suffering from post traumatic stress disorder. They're not in a safe environment, but we still treat them. We have victims of assault and rape who may be living in the same place where they were raped and assaulted who are being treated for post traumatic stress disorder. The few the little bit of work that's been done in this area shows it can be successful. And of course, it makes sense that it could be. Because really, if you look at at least the psychotherapies around post traumatic stress disorder, we're trying to normalize symptoms and reactions. We're trying to get the client to think a little bit differently about what they mean and what their experience has meant. I'm not sure you need to do the re-exposure aspect of it. They're going to be re-exposed perhaps later in that same combat environment, but just the way they take in the experiences will be hugely helpful for them even later if you think re-exposure needs to be implemented. But I think that there's no point in delaying simply because, well, they're in this combat environment, therefore you can't do this intervention. I don't think there's any data that supports that. It's really more, I don't even think there's a theory that says that. The one theory that said that was that you needed time to cognitively restructure your experience, right? This was the idea why you could only do one session a day. But the research with mass sessions where you do multiple shows that you don't need all that time. And so that argument kind of is weakened. I won't say it's completely dismissed, but it's significantly weakened when it turns out that you could probably do a successful PTSD treatment intervention with re-exposure probably in 1 to 2 weeks.
I think that what you're talking about, that's something that that started coming out several years ago, that
Yeah,
work. And I think it's something that, and I should probably do a better job of it. I should find somebody who's doing that work and like bring them on here to talk to them about it. But like, I think that that's something that therapists, like we don't talk about enough, because like the implications, like starting with PTSD, it makes sense, but then can you extend that to other problems? Can you, because the idea of if I can increase somebody's functioning that much faster, there's so much value for that person, for the people in their
yeah,
lives, for the society in general, that if we can make what took 6 months, if we can get there in 2 or 3 or 4 weeks, I mean, there's a huge benefit. I mean, you're talking about relieving suffering. I mean,
yeah.
just, that really makes a difference. I
It,
mean, anybody who's had a headache, if you have a headache for an hour versus a headache for 2 days, oh my
well,
goodness.
one of the things, and not to brag because I don't like those, but I'm the one who initiated that research when I was on active duty. Because from a practical standpoint, now this is where it becomes practical. I said, well, why is it 10 or 12 weeks? And and can we do mass sessions? Because in the military, a commander will let somebody go for 2 or 3 weeks to get better, but they're not going to somebody go for 3 months to get better. So just from a practical level, it fit more into an operational. And so I'm the one now. as you point out, the work it just came out a few years ago, but it was funded a decade ago. That's just how long these trials take sometimes. But that whole line of research, and I think we need to do this. Why? And also, when someone is suffering, they want to see some immediate improvement, right? And you're more likely to get an immediate improvement if you're doing these intense sessions over a week or two versus, well, I'm not seeing any improvement. So they drop out. The dropout rate becomes higher because I'm not getting better. And I mean, that's just only one of the reasons for dropout, but it's one of the key ones is I'm not getting better. Why am I wasting my time? And then just from a military, I can just order you, Castro, your job for the next 2 weeks is to get better. Go. I'll see you in 2 weeks. My mission's pretty clear. Get better. Right?
Mhm.
And if we have a evidence-based intervention that does that, and that's the key, we want evidence-based intervention. We just don't want to, oh, let's just do it. We need to make sure it works. And I was not surprised because just the way I think about these trauma and how it affects. I said, yeah, there's nothing magical. I mean, you probably couldn't do it in a day, but I didn't think it
Right.
needed 12, 3 months, right? I mean, it was,
Well, and and we're talking about 2 weeks, but if you take 3 months and turn it into a month and a half,
yeah,
that's a huge boon. I
yes,
mean, that's a gargantuan
yes.
win. I mean, 2 weeks is like a panacea, but like, to take it from 3 months and cut that in half. I mean, yeah, anyway, I always think that this area is, it's super exciting.
And I will
And
say
it's,
this Ed Defoe and Patty Resick, who they said, yeah, let's do this. They were not wedded to, oh, no, some people were, you need time to process. So what do you think is happening? You think like a veteran is just sitting around processing? They're not doing that. I mean, they don't even do the bloody homework you give them. So I mean, let's just be practical here and just see if just combine it with intensive individual therapy sessions, group therapy, which, unfortunately, the VA, some VAs have stopped doing because group therapy for PTSD is not evidence based. But I still think it's beneficial only because veterans say, I really benefit from this. I think the biggest benefit is it normalizes how they're feeling and thinking and
Mhm.
behaving. That's what they're getting out of it. I think that's an important element to recovery. It's sustaining your recovery as well as having these support groups that are helping you sustain it. So
Yeah, no, I think that's yeah. So just I should we should probably wrap up because I've taken so much of your time. But are there one or two other projects that you either supported or were part of that you're really proud of?
I think I the way my brain works is the ones that I'm the most disappointed in because
Oh,
it
right,
tells me
yeah,
where there's still a lot of suffering.
yeah.
And I alluded to my role, and I didn't do any of the research in these compressing the timeline for treating PTSD, but I'm very happy that I was a part of funding it and coming up with it. Look, let's do this. The thing that my real big failure, and I don't want to end on a downer, and that is all of the research that we have put in to preventing and caring for those who are suicidal has not it's not worked. And that's a big, I think about this problem all the time because we've been at it for decades, literally decades. And it's gotten worse. It may have stabilized. I don't know if it's coming down. It seems to be stabilizing, best case perhaps. So that I just encourage anyone who's listening, give some think, what can we do differently? Break out of the old paradigm of whatever it is we're doing because it's not working. And I know there's those who would argue, well, if we weren't doing anything, it could be a lot worse. That's not evidence based. I mean, it could be a lot better if we didn't do anything too. We could be one of my big fears is we're normalizing suicidal behaviors by talking about it all the time. That we may inadvertently be normalizing it in the sense of getting people to think about doing something they never would have thought about. And I only have anecdotal stories about that. Most people are not suicidal, full stop, right? Thank goodness. But we need to do a lot more work there. And one of the things I am also, I'm going to end this on a positive note. I was involved in a project tangent funding the project. While I was at USC, a pilot study of supporting Meals on Wheels program for elderly veterans. Now, oftentimes people don't think about elderly veterans needing Meals on Wheels, but this program was actually instituted because these were elderly veterans who their partner had died, their wife had died, and they were living alone and they wanted to live alone. But they were lonely, and we know loneliness and its association with mental health issues is a serious issue. But the Meals on Wheels program actually provides these elderly veterans with not only a nutritious meal, which is the whole point of it, but also these social contacts that,
Yeah.
once a day, twice a day, they're going to see
Yeah.
another human being and form a relationship with them.
Yeah.
And in the process, this person who's dropping off the meal can do kind of a wellness check that makes sure that the veteran is not looking uncapped and have some so I would love to see that program be expanded to keep veterans in their homes because we know there's not enough homes for them to be in. They need to be in their own homes. Most veterans want to be in their own homes because they're
Sure.
independent and all of it. And most people want to be in their own homes. But I think the Meals on Wheels, and that's always comes under attack as not being necessary, but I think it has all of the elements that we would want in an intervention: food, relationships, wellness check, early interventions, all of those elements that could be very, very powerful for all of our aging population, not just in the US, but around the world. But anyway, I'll stop there. But I think that's one that has a lot of potential that has only the surface being scratched to really maximize what it can contribute to the end of life for veterans. And as I mentioned, that's, it's really how you go out. You don't want to go out in pain and embarrassment. And so that I'd like to see is to spend a little more time and attention to.
Well, I'm just thinking about what you're saying, the social contact, and also just like you're saying, you're able to actually go to the veteran's home,
Yeah.
right? So that you just like going into, you see what's happening, right? Which is so much more accurate than them reporting to you, and that just provides so much insight. It makes a lot of sense, and it's so benign, I guess, right?
Yeah.
And it's not stigmatizing necessarily. But so before I let you go, the one other thing I wanted to ask you is: are there one or two resources that you would suggest that I can sort of link to for folks who want to learn more about what you're doing, and who are interested in?
We have a website, and I wish I could tell you I knew it off the top of my
It's
head, but
okay if
I
you can.
don't.
If
But
I can, what's the what would I Google?
so if you Googled University of Southern California Military and Veteran Programs, you would hit our website. And that we try to post all of our publications, all of our reports, things we're working on, initiatives that we have going for folks to become familiar with. Uh, that's at the USC level. The for veterans who need help, and by the way, I have no monetary, but the Cohen Veterans Network has 23, 22, 23, 24. They're always adding more clinics. They're all around America, all around the US. They provide care, mental health care, behavioral health care to any veteran and active duty, any family member, children, spouses, parents, cousins, uncles, free of charge. Free of charge. And I mention that because you can go. It was set up by veterans for veterans. It's free. It doesn't cost anything. It's You could still go to the VA and go to the Cohen Veteran Network. You can still see your private doc and go there for behavioral health care. You can go here for your physical health care. So it's a wonderful, wonderful resource and I don't know anything like it that's completely free, doesn't do any income based testing. It doesn't matter how much money you have or don't have, you can go there for free, and your family can go there for free. That's the important part. And because oftentimes, the VA will take care of veterans and maybe a family member if it helps the veteran. Here, they'll help you as a family member, regardless if the veteran benefits from you getting help. So it's just a different model that I really, really like.
Well, that's great. I'll link to both of these in the show notes so that they can just click on that. Thanks so much for watching. If you found it helpful, please like the video and subscribe to the channel. I'll see you in the next video where we continue to explore the science of psychotherapy and applied psychology.